Okay, so welcome to the Nerd Condition sessions where we're going through uh, the different conditions from A to Z and talking it through, kind of pulling in some clinical experience and um, also how the microbiome will, uh, how it relates to the microbiome, we'll say. Okay, so we'll go ahead and we'll start with acne. Um, what I have seen, I'm going to put long term and short term because I have gleaned from individuals that do a lot of dermatology type of work, um, that the longer someone has been on Accutane, and I don't know specifically how many years, but I was able to confirm that for every year they were on Accutane, they would need about a month of healing. And that falls in line with almost all the other conditions that we've had experience with. 1 year, it's 1 month of gut healing. So I would think if it's short term, a person is going to expect a lot quicker recovery. Now, using the TGR, there has been clinical studies going at the University of California, Sacramento, and the preliminary results are that the TGR will decrease acne by 50%. So that's good news, and it's good that we have some documentation. So I'm going to put that over here on the outcome. What I would say that is talking with some of the folks doing the dermatology work, even for the long term, that is holding true as well, that they're getting some good results in decreasing, whoops, my cut and paste. My mouse is acting up recently. It's not really doing its job. Okay, now I got both in there. Anywho, what has there been any clinical experience with either of you working with acne? What have you seen and what has helped the most?
I haven't had any clinical experience using these products with acne. I just noticed that when for my children, when I started cleaning up their gut, they improved. But when I started giving them raw milk, one of my sons whose acne was pretty bad actually improved.
Okay, interesting. So something in just the commercial milk, maybe the hormones, is that kind of what you were focused on there?
It was because I grew up drinking raw milk, and when I could find it again, I started buying it. Before that, I was buying the typical homogenized pasteurized milk because I couldn't find any other. And but when I started doing that, his gut improved, and I think it's partly because homogenization and pasteurization is it makes the milk a dead product basically.
Mm-hmm. Okay, so we'll put kind of cleaning up in general the diet, and specifically even changing to raw milk helped with that. Okay, so maybe we'd include detoxification. I think we can take that line of thinking a little further, and that it a lot of people detox through their skin.
Yeah. Another one of my sons, I put him on some Ayurvedic herbs and Chinese herbs, and because he had he's had the worst acne of all my kids, and
Mhm.
we were actually able to get that to, and it was through detoxing. These were herbs that help detox.
Okay. Super. Okay.
Recently, I have one teenage boy who has a lot of acne on his face, and I'd gotten him to the point to where I could start doing gut restoration stuff. So I had him start taking the Megaspore. I don't have enough data yet. Like it hasn't been long enough to tell one way or another.
Mm-hmm.
But at least I've started.
Yes,
Yep.
exactly. And I would think too that, as we've seen so many times, the detox will work so much better if we've addressed the gut, since the gut is intricately involved in detox. Okay. All right. So that I just wanted to fill in and then jump down to eczema, since that's kind of the same. We're seeing pretty much the same results. So I'm going to take that information down here. I can't remember where I started. Okay. But of course, eczema can be whole body. It just acne can be on the
Mhm.
back too, as well. But
Yeah,
I've
my
seen
son called it Bacne.
Acne. Yeah, exactly. I think I'm going to add that up there. I like that. Not just the face. We're going to say Acne as well. There we go. Okay. Yeah, the worst, I mean, eczema behind the knees, I think is where I've seen it the most. Um, the elbows. Oops, knees. Okay. And there's some pretty toxic treatments, that allopathic medicine has for eczema and psoriasis. So if we can avoid going that route. Any clinical experience with eczema?
That's my first client, actually, official client. She had whole body. It was all over. It was from a bacterial infection, but I think she had food sensitivities and heavy metals, and her gut was really messed up. And she actually started doing the Megaspore, and I don't remember if she did Megaspore and prebiotic, but it's hard to say which helped her because she was doing some medications because she was so miserable. She's like, I can't live this way. And it was like, well, if you want to do it that way, that's okay. But because she was a hit and miss kind of client with me, but
Mm-hmm.
she did. We also had to take care of Giardia and some H. pylori, and she's seen a huge improvements.
Yes, and I've actually seen some medications cause skin outbreaks. And then, of course, then they provide more medications on top of those medications. So that's
Yeah.
kind of get in that vicious cycle. Yeah. And, a lot of it, like, the bacterial, if it's, was it infection topically of the bacterial or was it systemic?
She had both going on. She in her yard, but she was doing yard work. She was getting it on her skin. There was some kind of bacteria that was causing a problem, and then also behind her water heater, there was some kind of weird growth going on the wall. So, but she had it for a long, long time.
Mm.
And I think, some of it I think was emotion, some of it was poor diet, some of it was because she had vaccinations back in the 60s, I think it was.
Mm-hmm.
So I think it was just a combination of a lot of things. We had to start cleaning her up.
Mm-hmm. Yeah. Okay. Okay. So I'm going to review some of the things because I didn't have some clinical feedback on some of these that I went through. So I'm going to review starting with the flagellants, the gas, and let you know, and you've probably seen multiple emails coming out. We've changed to a new software for the sales, and it's, the salespeople are trying to figure out exactly how to use it. And for each of these different coupons, there's a coupon on Mega IgG 2000, and there's a coupon on the new Fodmap, Fodmate product that we launched. And then there's a coupon on if you want to expedite a BioMFX. And so each of those are different campaigns, and they're each coming out with different emails. And so, I know that people have been, flooded with these emails until they can figure out how to combine some of these campaigns, to cut down on the emails, but they haven't figured that out yet. So I apologize up front. Hopefully they'll get it figured out. But one of those, as I mentioned, is this new enzyme that is going to
Tracy,
Yes. Uh-huh. Go ahead, Cheryl.
I tried to, yes, I'm sorry I was late. I'm having email problems, internet problems. I tried to order the Fodmate and the IgG last night and used the 2 different codes for the discounts, and it would only apply one to one or the other. And I wasn't able to get the discount on both. Is there any way to override that?
Yeah, because I know you can use them both. So were you put one in by itself and then set apply, and then you added another one and set apply, or did you put a comma in between them?
Oh, I didn't use a comma. Should I use a comma?
You might try that, putting them both up there, and then take a screenshot of of your shopping cart. I gotta get a drink of water. Doing a detox shake, and I don't know, the powder is stuck in my throat. But if you take a screenshot of your shopping cart showing that it didn't apply it, email it to me. I'll do a case on it, and we'll have customer service figure it out. They can make sure that it applies both.
Okay.
Yes, you
'Cause-
can get both.
Okay, because I think it expires tomorrow. Yeah, because what it would kick the other one out and default to just the Fodmate or just the IgG, but it wouldn't give me the discounts on both.
Yeah. The other option is just call customer service straight away and tell them you're having trouble and have them do it for you, without having to go through the whole case, filing a case. But it's up to you. You can email me, I'll file the case, have them call you, or just call them straight out.
Okay, I don't think I know what that number is. Is it on the website?
Yes, yeah, it's I believe a 904 area code. I think it goes through the Florida office.
Okay, I'll find it. Thank you.
Yeah, yeah. I had it memorized at one time, and that was a couple years ago. Now that's what automatic dialing does for people. We don't know any numbers. What's going to happen if we lose our phone and we're in a wreck and we need to contact somebody? I don't know. Anywho. So the Fodmate, if you've been practicing the Fodmap diet, which is kind of the latest rage, I mainly hear registered dietitians, maybe some NTPs talking about it, but it's a diet that is low in fermented oligosaccharides, disaccharides, monosaccharides, and polyols, which is hard to say. And the FODMAP is an enzyme that's going to help digest those oligosaccharides that are prebiotics to bacteria that are fermenting, causing bloating and gas. And of course, I haven't personally tried this yet. I'm anxious to. And I've been on this is my 11th day of a fast, which is helping tremendously with inflammation. But I would like to see how that enzyme works as I'm reintroducing foods. Anywho, any experience out there with, in general, flatulence and gas, specifically with the FODMAP diet?
Nope.
Well, I have experienced people when they start Megaspore, if they start it too quickly, as in they jump right into the 2 caps a day without the titration. That was one of I would say the main complaint or feedback was that they would get gas and bloating. So I know that when you're trying to shift the microbiome too quickly, that a lot of these bacteria start, releasing their arsenal to prevent from being, evicted from their homes. So I have seen that. And the answer to that was always, slow it down, add the mega IgG. If it still persists, go to the stair-step protocol of HU58 and then to Restore Flora and then to Megaspore. And almost always that's all it takes to get around that. But now with the whole introduction of, are there some resident fermenters that we need to take more drastic measures toward, putting them on a FODMAP diet, starving them out. And then the FODMAP diet is very difficult. If you've looked at the foods allowed on that, it's like all my favorite foods: onions, garlic, asparagus, all that stuff. So, a person, and of course it's dairy and wheat and the regular things too. And a person, can do, I think, the major things fairly easily, but some of the minor things that really it doesn't make sense that such a healthy food could cause so much gas. But that's where the FODMAP is going to help out, that you can cheat a little bit in order to stay compliant with the majors. And that way you're going to starve out those fermenters and then, reset by giving your keystone strains a better foothold with the TGR so that they will maintain control over those fermenters. Okay,
Tracy,
yes.
where does this impact Candida? Because I'm beginning to think that I have a problem with this bigger than what I thought or realized.
Mm-hmm.
Will the FODMAP, I don't know where Candida falls in with all this. I know it's a yeast, isn't it?
Yes. Yes, it's a yeast, and restricting diet is helpful with Candida as an anti-Candida diet. And I would say most of the things on the FODMAP diet, like dairy, like glutens, those are going to be some of your higher sugar containing foods anyway. So, doing a elimination diet will be helpful, because the issue with Candida is it has several life cycles and it has a dormant phase. And you'll find that you can get rid of some of the, the yeast spores, and then the, the hypha that dig into the tissue. And then for some of the biofilms, you have to be prepared that, that they're going to come out again after you think they're all gone. So you'll do a killing, and then you might purposely bring back some fruit juice and some things to pull it out, and then hammer it again. So that's why Candida is always one of the most difficult things to get rid of because of those life cycles. Anyone else have some clinical experience? I think, didn't we have Candida listed here somewhere? Oh, well, we need to add it. Any direct experience with Candida?
I'm still dealing with it.
Okay. How many years has that been?
Well, it's because it was hiding, but I've also learned too that sometimes you have to treat this, like the parasites and the bacteria and not necessarily viruses, but you have to treat those guys first because the Candida will feed off of those guys. And so if you treat them first, get that out of the way, then you can get to the Candida, get it back under control.
What do you do to do that?
Well, I mean, because Microbiome Labs doesn't feel that we should go after parasites, but sometimes I think you do because they're harder to get rid of. They also, there's like a kind of an agreement your body has too sometimes with these parasites because they're kind of soaking up the heavy metals and the glyphosates and the toxins. So you have to be prepared that while you're killing those off, you're going to need to take some kind of binders to absorb all that stuff that's going to be coming out from their bodies dying off. So there's herbals out there that help kill off parasites. There's but you have to be careful too, because you don't want to go, you have to be careful, because of the die-off and stuff. So you have to take it slow. But I'd always make sure that you're taking like Megaspore or the Restore Flora or the HU58, something like that, to support your gut while it's killing these guys off, and then do things to absorb the die-offs.
Yeah, and just to add to what Sheila is saying there, in the beginning, there were folks using some really harsh biofilm busters and pharmaceutical, nystatin, and there's another really strong antifungal. What's the name of that besides the nystatin? I can't remember right now. Diflucan.
Is it fluconazole?
Yeah.
Well, maybe that's another one. Maybe
Yeah,
that's
it's close.
a type of a diflucan. Yeah. So, some of those, to try to avoid some of those, but like what Sheila's saying, there are some herbal, like biocidin, that are effective, but not as, going to cause as much collateral damage. So, there's some options there. And what we know about Candida, it has this ability to bind with the heavy metals. There's some weird association going on there. We know that some Candida is commensal. So it's not like we want to completely eradicate everything, but certainly when it's causing symptoms, that we keep it in balance. And some of the symptoms it's known to cause is to release these exotoxins that can travel to the brain. And, that's kind of the worst case scenario.
So this Restore Flora, this one has just recently caught my attention. What is that product about in relationship to the total gut restoration protocol?
Yeah, sometimes we'll add Restore Flora to the Megaspore because of that Saccharomyces boulardii. So you're getting some competitive exclusion by adding more spores, but then you got the Sac B in there, and it seems to work is when you have a commensal, a friendlier yeast, such as the Sac B, it'll compete for resources that the Candida would otherwise use. So you've got kind of a yeast working against a yeast.
So would this be a good thing to add or wait until the TGR, done the 3-month TGR?
Really, if the symptoms of Candida are to the point of being intolerable, I would add it sooner than later. Any feedback on that from the other clinicians?
It's kind of tricky because sometimes if you're working on one thing, sometimes you have to switch to focusing on the Candida and then go back to the TGR, or work on the Candida first and then work on the TGR. It's just, it varies, which is nice that you can do that with this whole microbiome lab stuff, is you can vary it to whatever needs to happen for the person.
Yeah, and we saw that with the undeclinic acid, and hopefully we'll get that product back because it was very effective for yeast, but yet sometimes the die-off was so intolerable they had to put it on pause, go back to the gut healing, and then they were alternating these protocols to get through their Candida treatment, and it was really just about how much the individual could tolerate. For a lot, for me, when I was doing it, Candida affects me, makes me extremely agitated. So now that I have no husband or son or kids to pick on, maybe I'll try it again.
Also, if you take binders, that should help absorb some of that die-off. So like the GI detox from the biocidin people, or Cellcore has one called Biotoxin Binders, which helps absorb some of that. So it's pulling it out, so you're not dealing with the effects as much.
Yeah. And typically we'll also, we've got the Mega IgG. We use that abundantly for many of our protocols, but it's for the same purpose, trying to neutralize these antigens that's overwhelming our immune system. But it's good to, we bring up all these other resources from other companies too, because, no one is going to be the expert on all things. So as practitioners, you really have to try to pull from the best where you can find it.
I use Dr. Pompa's TCD, True Cellular Detox protocols, and I have found those to be very helpful.
Super. Have Sheila or Dr. Kev, have you heard of that particular practitioner before?
I've heard of him, but I haven't followed him very closely.
I have not.
Okay, so if we go down onto
He's a chiropractor.
Oh, go ahead. Oh, sorry, I was talking
He's a
over you.
chiropractor who has, it's okay. He's a chiropractor who has had his own health challenges, and through, trial and error, he was able to turn around his health, but he teaches a very comprehensive process. And they talk about the microbiome stuff, as well, and switching out the different different products so that you're seeding the gut and getting different, bacteria, excuse me, in the gut.
Okay, so now we're moving on. I don't think we've just discussed as a group the GERD, which we're talking about more upper digestive issues, the dyspepsia, heartburn, reflux, so forth. And this has a lot to do with the breakdown of pH barriers, which the bacteria see as zip codes, so they know where to live. And when those go away, that's typically where the SIBO will result. And using the TGR with the combination of the MegaGard to help restore those pH barriers, to help with the motility. And then if H. pylori has moved in, it helps with that. Any other clinical recommendations you would like to add to this?
One of the things that one of my herb teachers taught me was sometimes GERD can be caused by a hiatal hernia. And so you have to know how to push that back down.
Yes.
That could help. And then in my FDN course, they were teaching us that if somebody has H. pylori, you want to make sure that they're not necessarily, and it's kind of controversial on this, but you don't want them taking hydrochloric acid because H. pylori feeds off of that. It kind of changes its pH and makes it the way it wants to be. So if people are having a hard time digesting protein, you can do a papaya bromelain or papaya pineapple enzyme, because that would help while they're trying to digest their proteins. Some people go so far as not to even eat protein while they're dealing with that, but you need protein.
Mm-hmm. Yeah, so there's definitely, a physical issue, and I know Standard Process had a procedure that they used to teach in how to manipulate that. I don't know, Dr. Kev, do you practice that in your practice, helping people with the manipulation of the hiatal hernia or diaphragm adjustment?
Yes. Yes. What's really interesting is I have found a correlation with those who have the over-aroused nervous system and the hiatal hernias. The anatomy of the esophagus with the stomach and the hiatal hernia itself, you have ligaments that actually attach the stomach to the esophagus. And if somebody has a hiatal hernia, that means they stretched out. And then you have to go one step further and say, all right, why is there a hiatal hernia? And I do think that it's caused by the overactivity in the brain, causing the muscles of the esophagus to tighten up, and therefore pulling the stomach through the diaphragm. So if I adjust them and they get better and it's good, we're good to go. If not, like if it comes back, then it goes back to the whole brain activity causing it in the first place. And so that's where it gets a little bit more complex in terms of trying to deal with the GERD or heartburn. And then what I learned was that if you have a hiatal hernia or heartburn, you actually need more acid because if it's coming up the superior sphincter, that means it's not going down into the small intestines, and you have to have a pH of 2 and go out of the stomach itself. So that's interesting difference from Sheila.
Yeah, they were saying it was controversial because some doctors were saying, no, you need it. And some were saying, no, you don't need it because it actually feeds the H. pylori. So I just go with
Yeah.
based on what the patient or client experience is, because
Yep. Now, here's what I've run up against is if the hiatal hernia is so bad, like if it's been in a chronic position / not in the right place for a long time, then when you do add the acid, then it goes up and it makes the heartburn worse.
yeah.
Mm-hmm.
But once everything starts to get under control, like this one person, they couldn't handle like Zypan or Betagest, which is a different, it's hydrochloric acid by Neolife. And they couldn't handle it at first, but then they messed with it and eventually found out exactly when the best time was to take it, right before they ate. And now the heartburn is improving. So
Okay.
it's kind of interesting.
Yeah. And I'll mention in here, if someone presents with medications, there's a lot of over-the-counter things now for all of those conditions as well as pharmaceutical. And, as much as I would, when I was in practice, would tell people, don't cold turkey anything. Well, no, remind me, what's the blue pill called? That's for heartburn. Xanax, is it Xanax? No. Pepsid? No. I forget now. It's been so long, but it was a very common prescription reflux medication, and I, started them off on the whole change of diet, detoxification, and they were taking that prescription. They were taking about 4 to 5 a day, and they went cold turkey. They experienced projectile vomiting. So, you might just keep that story in mind, just to remind people, don't cold turkey medications. Again, you can't ever tell them, how to, to stop taking medications. But what I would always say is, if it was me, I would wean down from the prescription as I'm ramping up on the new things so that I'm not caught in the gap where my body doesn't know what to do. So that was traumatic. Okay, so, and I was going to give you the explanation too about the bile. A bile is antimicrobial, and a lot of the upper digestive issues can also be due to slow bile release. So they have a sluggish bile. It's too thick, or they have a gallbladder issue going on, or they have gallstones. So what the MegaGuard helps with, that globe artichoke, is to help thin the bile, help the gallbladder in production, so that you get a continuous flow. So it keeps a lot of these organisms that normally without the bile would overgrow under wraps. And so that product's been very helpful. And if you have dysbiotic.
So one of the things.
Go ahead.
I was going to say also, one of the things I learned too is sometimes if you don't have enough bile production, because it's supposed to neutralize the pH in your small intestine. So I'm trying to remember how they said it. So if you don't have enough, then your body will start lowering your digestive enzymes, because it's like, oh, too much. It's some kind of feedback loop. I forgot exactly, but go on.
Yeah, there's a lot of, just even with
And
a
Tracy,
lot of. Yes, go ahead.
what happens if somebody doesn't have a gallbladder anymore, that they, the doctor talked them into removing it because it wasn't producing, or it was blocked, or they had gallstones, or whatever reasons that they use to remove body parts?
Yeah. Then those folks remove. We try to mimic if they, what they need because they don't have a gallbladder. So those folks would be on Megagard continually and some ox bile, or there's some other sources besides porcine. I guess, is ox bile from an ox? But anyway, there's, you want to try to create the bile salts and yeah, the idea that your liver's still producing bile, you just don't have a reservoir to collect it in. So you want to make sure it's thin to, keep, because it's, dripping still into the small intestine through the portal, but there's no reservoir to collect it. Am I on base, Dr. Kev?
Yes.
Okay. Okay. And then we had a
Tracy,
lot.
one of the things that I had heard.
Go ahead. I'll always stop when I hear you start
Can
talking.
you hear me?
Yeah, I hear you. When I stop, just go ahead and continue.
Yeah, well, yeah, there's a big delay. One of the things that I have heard is that once people have had their gallbladder removed, initially they feel really good, and then after a while they start having problems again with digestion, and things bother their stomach and intestines and such as that. Is that why you're saying to mimic the gallbladder function by using the Megagard and the ox bile?
Yes, and of course the TGR, because not having a gallbladder is going to change the whole environment of their microbiome. As well as their higher chances of getting colon cancers and intestinal cancers, because it's not, it's dripping in one spot and usually causes damage in that area. Okay, now there's multiple reasons for headaches. I tried to identify some of the most common ones here, and focused here on how the gut, you got the strobilome and the, how did I change that? The psychobiome, where we're recognizing the importance of the gut bacteria and their role in hormone and transmitter. But we know there's a whole lot more to balancing hormones than that, and you might just refer back to the hormone section. For that, because there's a lot of considerations, and headaches is just one of the many side effects for hormone issues. And I would add to this, many times it's, menstruation, cycling issues as well. Food sensitivities. Yep. Different triggers, some foods. Oh, I'm trying to think of some, MSG, Salt for some, you know. or-
Sugar.
Yeah, sugar. Milk. Any other triggers that come to mind?
Chocolate.
Yeah, yeah. Looks like I listed some over here too. Gluten, egg, and soy. Those are kind of the standbys. I usually, anything that's made out of soy, my nose can't get past it. It just smells rancid to me. So I don't know what that's about. Okay. Of course,
Well,
dehydration.
considering that 80% of soy is GMO.
80% of soy is what? GMO. That's right.
Is GMO.
Correct. Yep.
Mhm.
I'll add that in. Yep. Okay. Environmental exposures. I mean, let's see, I've added some in here. Mercury, lead, heavy metals, glyphosate. I'm going to add diesel. I mean, I will get an instant headache. Well, I guess those are ingested. We'll add another category for inhalants.
Diesel has always made me extremely nauseous. I can't drive behind a bus or, you know, a vehicle that is putting that stuff out. It just makes me want to throw up.
Yeah. Now, I own a diesel truck now. I swore I would never get one, but it has the DEF and I don't smell it at all. So apparently the new environmental restrictions require DEF and it removes something in the diesel. Maybe Dr. Kev knows the auto mechanics of that, but it does work.
I actually have no idea.
So, all right. Let's see. I live near, or I
In
grew up.
terms of headaches, though, one of the things that I know is weather. Weather changes and weather patterns
Yes.
greatly affect headaches for some people.
Okay.
Yeah, I woke up with one this morning. We've got all this overcast and storms. I usually don't get them anymore.
Do you think it's more due to change of pollen, or how does the weather affect? Is it more inhalant pollens, or is it?
I think barometric pressure.
Oh, okay. Okay, so the consideration barometric. And I'm not sure what you can do about that. I mean, are there any treatments that people have figured out? I mean, you know, like eye strain, these blue blocking glasses. I'm wearing actually 2 pairs of them right now. I think it helps.
For the barometric pressure, I can't really think of anything unless it's just help the nervous system be able to handle and process it better. Maybe it's something like a sensory overload.
Okay. Maybe it's sensory overload, maybe it's 5G. Maybe need an adjustment. Maybe you need to move to Idaho.
Couldn't you use like some essential oils though to help relax the headache? Like, because it's gonna either be what's it called? Vascular strict. I can't even speak tonight. Where it squeezes or it expands. So couldn't you use something to help?
I love that
Oh,
idea.
vasoconstriction or vasodilation.
Thank you.
Yeah, I love that idea. I mean, that for like, that's what I would use, for the diesel issue. Because it's like the body closes down to protect itself. So I'm going to add essential oils up there too. Okay. Okay. So this is the hormone balance, typically affecting sex drive, weight control, bones, skin, fertility, put cycling as in menses, cycling. And there's, we want to keep in mind too, there's andropause. Issues. And, where I've seen, where actually Ken really was the one dealing with it, there were a lot of low T clinics in the, the Dallas area. And we'd get some of these men coming in and they had high iron and they had high, the iron storage. I forget anyway, Ken would do the blood tests on these and they were at toxic levels. And so he would, recommend that they go and donate blood, to reduce their iron levels. We'd do some, zinc, different things to help compete with the iron and bring the levels down. But I don't know if those clinics are conscious of some of the side effects of primarily I guess it was testosterone pellets. And then the problems with the testosterone gels they found was, some of these, men would have babies and children and dogs, and they would get that gel on their hands and start touching all these things in their home and their family. And then all of a sudden, these little babies were developing gynecomastia. Well, that was for the estrogen. Sorry, that was with the women with bioidentical hormones on their hands. But with the men, it was the same deal. With high testosterone levels in their infants and animals. So we have to be really careful and warn folks when they're doing these gels and creams about that. I don't know. Has anyone seen that?
I've heard it, but I have not seen it.
I have not either.
There was a CSI program that had, it was a community around a reservoir, and we know that, each drink of water is 22 flushes until the next drink of water, and all of the birth control pills, go through the sewer and would go into this reservoir, and then they would filter it and clean it up and, recycle it into the community. And they had a high rate of young teenage boys with gynecomastia. So, these are, just things to pay attention to when you get some of these folks coming in, find out their living conditions. When Baylor did their study of the Denton Tap, they discovered the amphibians, male amphibians, birds, wildlife around there, all of the males were turning to developing female characteristics. So it's a real deal. You want to keep that in mind when you're doing the histories.
They're also seeing that, I'm sorry, they're also seeing that in baby boys. They're being born with shorter perineums, and they have less testosterone in their bodies, and they're more feminized. These newer male babies. I'm sorry, Kevin, go ahead.
When I was taking my public health class, we were discussing this type of topic, and there is an accepted amount of drugs and all kinds of drugs allowed in our drinking water. So yeah, it is an actual problem.
Yeah, and that the whole thing also when the mother is
and about 25% fecal matter.
Yeah, I think there's so much rat poop that's allowed. But when the mother's carrying infant boys, fetal, male fetuses, they're not getting the proper testosterone wash, is one of the issues as well, because of the mother's health and exposures to environmental, water, air, whatever she's picking up is affecting the development. Okay, so indigestion falls in category with the whole Gerd reflux. Now, I'd listed here insomnia, which as a practitioner, I would say that was the number one hardest condition to treat. And I don't know what y'all's experience is on that, but I think there's nothing worse than someone, who has to drag themselves through the day, lay awake all night, and just the cycle repeats itself. So I broke it down into temporary, which can be, life situations, travel, stress, and sometimes, just a simple melatonin can help reset things. And then, dealing with ongoing
herbs.
Say that again, herbs?
Yeah, nervine herbs. Nervines, or nerve herbines, or however you want to say it. Herbal nervines.
Okay. Nervines, okay. Yeah. I don't know. What are some of like kava, chamomile? What are the other relaxing herbs?
Hops.
Ashwagandha.
Ashwagandha, and there's the name escapes me.
Minchex.
Yeah, the minerals, magnesium. It's hard
and
for me.
Calcium too, sometimes.
Yeah, the standard processed calcium, just because it's the plant form.
Plant-based.
I never recommend the calcium carbonate stuff. We want limestone.
Now here's when I have a new patient. And start adjusting after a little while, 4, 5, 6. Sometimes it's after the first one, but not always. People will say, and these are the two most common side benefits that people say, is they can sleep better and they have better digestion. So it could also have to just do with the brain waves and whether or not they're stuck in the stress state or not.
Okay, so another, looking at adjustments for neurological balance. Okay. Yep. Now, back in the day, neuroscience was promoting a lot of testing and products for insomnia, and they would check cortisol levels throughout the day. And, when the people typically will wake up at 1 or 2 in the morning, and then you check the cortisol level again, I mean, yes, some of these people, when they're identified to have, those kind of cortisol issues, then they would really just treat the adrenals, which is, where the cortisol is, coming from. But even then, it was still kind of a 50-50 shot as far as helping these folks.
Typically, if you're waking up between 1 and 3, you have liver issues.
Yeah.
Based on the Chinese clock, and
Mhm.
between I want to say 3 and 5 is lung, but my chiropractor told me that if you're having lung issues, it could be because your lungs need adrenaline to work. That's what she said. So you could trace it back to adrenals. But there's also, you have to look at traumas in the body. You have to look at parasites can cause insomnia. Liver stagnation can cause insomnia. I mean, there's a lot of things.
Yeah.
I know because I'm dealing with it.
Wow.
I've been dealing with it for 30 years.
Wow. Yeah. It's a real conundrum. It's kind of like the whole headache issues, because when I kind of started what I would say menopause, I went through every one of these to figure out what is the trigger. And I think it's the same with insomnia. A person goes through the checklist, and it's really baffling.
And if you're dealing with life and it's unexpected happenings, you have that added onto it.
Exactly. Crisis. Exactly.
Mm-hmm.
Which it seems like, we've all kind of been in some form of crisis for over a year. It's like everyone's had this impending doom hanging over. So we have to really look for any joy and encouragement that we can find. Okay. So I don't know. Libido's a really tough one too. And I love the diagram, that a lot of, when you go to the hormone balancing conferences and they show, the man with the big red button, and then they show the 747 control panel, say, here's, the man's libido, and then here's the woman's libido, and you have to adjust the control panel about 50 different places to line everything up and get all the settings right. And then something happens. But, that's simplifying it, but it is complicated. So, and it seems more so for women than men. I don't know. Do you disagree, Dr. Kevin?
I don't know. I have no data at this point.
Okay. Good answer. Good answer.
I don't have enough patients that describe it yet.
Okay. Well, I think it will come. I had a office in a pharmacy, and this particular pharmacist put my desk in the middle of the pharmacy so that I could, see when people came in and see if they went to the supplements on the counter and be able to help them. And I said, this is not going to work because I do hormone balancing, and a lot of these people are trying to tell me about the libido, and it's not private. You know, I need an office because it's, you know, people don't want to talk about their libido in public. So anyway, that's my libido story.
Yep.
Okay. All right. So now we get down to SIBO. We kind of hinted on, you know, this before. It's usually presenting as, you know, upper digestive symptoms, can also involve, you know, gas and bloating, pain. And there's a lot of these SIBO tests out there. I don't know exactly how, you know, accurate they are. You know, I've heard it kind of go back and forth. But if we understand the kind of the progression of the breakdown of the microbiome of the entire digestive tract, then SIBO is going to fall within that. So, you know, whether you're dealing with the upper or the lower, you know, you still have to restore, you know, the control center. And, you know, then we've got things that are going to help specifically with the gallbladder and H. pylori issues. And you've got to keep things moving. This is another big component of SIBO, is a lot of these folks are prone to constipation. And, you know, the body's designed to eliminate the waste. And when you're recycling the waste and toxins are recycling, that's causing a lot of damage to those zip codes as well. So I'll say just motility considerations to prevent constipation. Anyone dealing directly with any SIBO patients?
Nope.
Okay. Oh, I didn't know it was 11 minutes after the hour. Okay, so let's wrap up. I see we're kind of coming to the end of what I had added on this. If you want to shoot me an email with some more conditions we can add to this list, then that would be great. And we can go over those next week. Again, it's great to have Sheila back with us. And I just want to wish you all a terrific rest of your week and a restful weekend. So be safe, take care, and keep in touch.
Thank you.
You bet.
Thank you.
Bye-bye.